Hello everyone, welcome back to the channel. This video clip is a part of a bigger video which was released few days back where a reputed medical oncologist Dr Hemanth Kumar discusses about a new magical drug, that is dostarlimab, in the treatment of rectal cancer. While discussing these things, he also mentions as to how newer and newer modalities of drugs are revolutionizing the treatment of cancer in general. One of such thing is what's called as a targeted therapy, where a drug, Imatinib, has revolutionized the treatment of CML. Because of this drug, Imatinib, patients are surviving for more and more years. Let's hear what Dr. Hemanth has to say about it.
If you consider broadly what are the specific medications that can be used in patients with cancer, the earliest and the most common drug that all of us know and many of us fear is chemotherapy. Most of the patients do not come to us for treatment because the word chemotherapy is used. Chemotherapy is basically a chemical compound used to treat patients with cancer.
That's been the conventional treatment for a lot of cancers.
It's been the conventional treatment, and the way it works is it kills basically any cell that divides fast. Right?
Yes.
So we know that cancer cells are fast dividing cells, and hence chemotherapy works against that. At the same time, it affects normal cells which divide fast. So most commonly, you know that patients complain of hair loss.
Hair loss,
Right? Hair loss is basically the hair cells are dividing fast. They can get nail color changes. They can get oral ulcers, etc., etc.
Because it thinks that too as a cancer cell and basically it's dividing fast.
Fast. Whatever divides fast, it tries to attack that. That was the first era of chemotherapy. Then we came across a drug called targeted therapy. Now, in the year 2000, there's a specific cancer called chronic myeloid leukemia. It is a form of blood cancer. In the 90s, people would survive maximum for 2 years, 3 years, or maybe even just 5 years with that cancer.
Once it is diagnosed.
Right.
Yes.
So in the year 2000, they found that there's a specific target called BCR-ABL and a drug called Imatinib. Now, this Imatinib directly targets this molecular pathway called BCR-ABL. And when it does that, this cancer is very well controlled, goes into remission and almost nearly a cure. Once this drug came into the picture in the year 2000, people with CML are living for more than 10 years now. It has become like diabetes or hypertension, if very well controlled and treated. So that is where the era of targeted therapy started, and now we have got multiple drugs which target specific pathways or specific areas with the cancer, especially for lung cancer, for head and neck or oral cancers, for kidney cancers. So multiple cancers have targeted therapy.
So these are not, these don't come under chemotherapy?
No, these don't come under chemotherapy. They are usually oral medications many of the time and have a lesser side effects or a different side effect profile compared to chemotherapy.